Hi everybody, welcome to Chapter 3, The Environment of Marketing Strategy. Chapter 3, Learning Objectives. First, to understand the impact of the 5 environmental forces on organizational strategy. Explain how social and economic forces affect marketing strategy. Describe the impact of technology on healthcare organizations' survival and competitive environment. Know the major regulatory requirements that must be followed when formulating healthcare marketing strategy. Introduction. Environmental scanning for potential impact on the organization's target market is conducted to assess trends in each of the 5 major environmental forces. We have the economic, technological, social, competitive, and regulatory. Environmental scanning is the acquisition and use of information about events, trends, and relationships in an organization's external environment, the knowledge of which would assist in planning the organization's future course of actions. Here we have the 5 major environmental forces: economic factors, such as inflation's effect on the cost of borrowing and consumer income, which includes gross, disposable, and discretionary income; technological factors, such as the impact of innovation or inventions on cost, quality, information, and behavior. We will discuss environmental factors further. So why are these forces important? Because they are a method to continually scan environment. Conducted to assess trends over a period of years, environmental scanning is conducted to assess the trends in each of the 5 areas for their potential impact on organization's target market. To know what needs to be done appropriately, adjust the marketing mix strategy. Economic forces. Inflation, which is the decline of buying power when levels rise further than income. Healthcare costs as a percentage of GDP has steadily risen over the majority of the last 40 years, and healthcare spending in the U.S. remains much higher than most other Western countries. Consumer income varies by ethnic and racial group, with African Americans earning 67% of the median income, while Asian Americans earning significantly more than any of the other groups. These disparities are important because health is directly tied to income. You see, gross income is the total amount earned by a person or family in 1 year. Disposable income, the amount left after taxes to spend on basic needs, and then discretionary income, the amount left after taxes and basic needs for recreation and entertainment. Technology drives industry. Impacts healthcare with improved quality, but has cost implications as new entrants to the market and existing products or services are pushed out. Impacts information for clinicians and administrative staff. Healthcare information technologies such as databases and electronic medical records have had a large impact on clinicians and administrative staff. Affects consumer behavior with search on the web. This has been increasing dramatically over the past 20 years. Transparency has increased due to technology, state and federal regulations. For one, self-motivated, many organizations are doing it on their own. Third parties, this could be third-party payers or other organizations that report information. Social factors, demographic or population statistics. Aging population is growing. We look at some of the statistics in the next slide. Healthcare organizations responding to aging marketplace. This requires a shift in focus to capture the needs of the elderly. Here in this graph, we see a major increase in the population 65 or older from the time of 1900 to 2010. The family marriage rates in the United States are at historic lows, while divorce rates are falling except among baby boomers. Social factors, geographic shifts. People are moving west while population in east remains about the same. We are currently dealing with a more transient population increasingly moving to the suburbs. Racial and ethnic distinctions, minority percentage growing, and over 12% are foreign born. Due to these factors, cultural competency has become an important component in the training of healthcare providers and delivery of healthcare services. Of course, healthcare organization and healthcare marketers need to take these factors in consideration when strategizing. Culture, the roles of men and women. There are more women working outside the home and heads of household over the past 30 years than ever before. Women are more active searchers of health information on the web than men. Changing providers. More females are prominent in healthcare positions such as physicians, physician assistants, and the number of men entering the nursing profession has increased significantly. The idea of culture incorporates the values, customs, and conforming rules passed from one generation to the next. Although salary disparity exists between male and female clinicians. Complementary and alternative medicine is a $9 billion market which is primarily paid out of pocket by consumers. Concern for health and fitness has increased. Movement beyond a sickness model in healthcare to a population health approach under the accountable care era of today and administered for hospital readmissions. Many of these institutions institutions are increasingly developing medical fitness facilities. Here we see a graph showing the most common complementary and alternative medicines. The continuum of competition. The fourth major component of the environment pertains to competition, the alternative providers of healthcare service. Here we see monopolistic competition, where you have many sellers and companies have suitable product. Price is key. Pure competition, or perfect competition, has many sellers, substitutable products, and little differentiation. Basically, all companies are offering the same product. Oligopolistic competition shows fewer large sellers, a control of the majority of the industry sales, similar product, and little price cutting. A monopoly, typically one seller that sells a particular product, which is unique, and regulatory oversight will incur based on monopolies. Regulatory factors such as competition, pricing, distribution, promotion, self-regulation, and the HPHM Act. Competition. The healthcare landscape has changed in recent years due to increased regulation. Antitrust regulation against monopolies, such as the Sherman Antitrust Act and the Clayton Act, have been prominent when dealing with monopolies. Product legislation such as trademark protection emerges. The Herfindahl-Hirschman Index is used by the Department of Justice to measure overall competitiveness of a market. Healthcare competition. We recently evolved from an environment dominated by HMOs and capitated payment systems to a more fee-for-service model. Accountable health plans are becoming more prominent due to the Affordable Care Act, and international competition due to medical tourism. This has become so popular that the Joint Commission has started accrediting healthcare organizations internationally. Future medical tourism, transparency, and reference pricing. It was discussed earlier that pricing transparency is nothing new abroad. Due to medical tourism, reference pricing is growing in the United States. Domestic medical tourism is being utilized by many companies that have self-funded insurance plans and can ultimately reduce their costs by 20 to 40%. Pricing has several regulations that relate to reimbursement, such as the Sherman Act, addressing price fixing and price discounting. Discounts are allowable provided cost savings can be demonstrated in dealing with particular buyer. Price fixing not specifically illegal according to the Sherman Act, but considered illegal overall. The government has three major areas of concern when it comes to distribution. Exclusive dealing, illegal to require buyer to handle only products of one manufacturer and not competitors. This is a violation of the Clayton Act. Requirements contract, where the buyer is required to purchase all or part of its needs for a product from one seller for a defined period of time. And tying arrangements, where the seller of a product requires that the purchaser also buy another item. Promotion is also a subject of various government regulations. FTC forbids deceptive or misleading advertising and unfair business practices, and can order a company to conduct corrective advertising in which a company must correct misimpressions formed in the marketplace. Self-regulation. Gifts must be nominal. Education items and patient care items should be used in the marketing process to avoid enticements. Multiple interest groups, such as the American Medical Association, has developed guidelines when it comes to gifting. In summary, marketing strategy must be developed in response to and in concert with a broader macro environment. Economic, technological, social, competitive, and regulatory forces can all determine the effectiveness of any organization's marketing program. In recent years, the rise in cost of medical care has slowed. Healthcare reform, high deductible healthcare plans, and health savings accounts are alternative insurance forms, making customers view healthcare as a product to purchase. Healthcare is a technologically driven industry. New technological advances dramatically affect the institutions and providers who deliver healthcare and determine how that care is delivered. The internet and wireless communications will dramatically affect how patients interact with their healthcare providers. The changing demographics of the U.S. population represent significant opportunities for healthcare providers. The fast-growing segment of older consumers are major utilizers of healthcare services and products. Baby boomers are often attracted to alternative medical approaches. Changing marketplace demographics related to gender, ethnicity, and race require healthcare providers to be more responsive to the needs and concerns of diverse consumers. The competitive market can be defined as either a pure competition, a monopolistic competition, an oligopoly, or a monopoly. The differences represent the number of sellers in the marketplace. The prior movement to managed care is now returning to a fee-for-service market. Inpatient admissions are rising, and outpatient surgeries continue to grow. A wide variety of federal and state regulations exist that affect each aspect of the marketing mix. Mergers and acquisitions have been a great concern for regulators. The issue of provider referrals is also highly regulated. HIPAA regulations also impact the marketing activity activities and communications that can be conducted without a patient's consent.